anybody remember the name of the tablet? ICX. That's not on your evaluation. Well, not on this one. I just wanted to see if you guys remembered. Good job. Oh, sorry, I didn't mean to. Okay. So ICX tablet at the beginning of the day. Fill up your water bottle.
You only put one tablet in the one too.
Yes, only one. If the water runs out at the end of the day and you need to refill it again, you put a new ICX tablet on it in there. Okay. Okay. Let's just explain this. There is a diagram on here that will kind of help you guys a little bit, but let me show you the. You know what? Let me not worry about that right now. I'll go through each of you guys individually so you know how to use it. So let me just put this that way. Okay. That was easy. You would think. Okay. Oh, master power switch on the side of the bracket tray right here. Turns on. This little blue light indicates that the chair is on. So if it's not on, then you know something's wrong. You can always call me and let me know, and then I'll help you fix the chair. Okay. Okay, so that's our master power switch. It's over here. Same side where it was on our other chair. The water power switch is going to be on the same place in our rheostat. Let me take that out. What was this called? Rheostat. Yes. And then this is our water power switch. Like I said, it's the same. Over the blue dot means it's on. Yes. Okay, the bracket tray adjusts. Here's your little button. On the other one, it's a silver button at the end of the thing. This one's over here on the front. But it's what you're gonna press to move your bracket tray everywhere. Let's go over the saliva ejectors again. Why not? This one?
High volume evacuation.
High volume evacuation or oral evacuation. Okay. I don't want you guys to get confused. So if you call it HV or oral evacuation, they'll both be right because they both are right. This one? Saliva ejector. Your saliva ejector. Last one?
Water and air.
Your triple air water. Air water syringe is fine. They call it triple because it does 3 things technically, but air water syringe. Okay. Everybody's good on those? So we're down to number, I showed you guys the rheostat again, so we're down to number 8. So operating light switch on the new chair. There's 2 places where you can control it. You can control it from here. This is your on and off switch. You guys see over there. And then your dimmer is down here, meaning there's different settings. This one's for the doctor when he's doing procedures. Oh, actually, this is the light that you use when you're using your curing light, which is number 14. That's not on part of the evaluation, but it's nice to know. Okay, so this is, this will be your light dimmer here to switch between settings. And then this is your on and off on the bottom. It's in the same place in the old chair, they just look different. Another place where you can control the light is here, this button up top. It will help change through the settings. Cool. But you can't turn it off from here. Okay. Where are we?
Well, you have to have both of those for the eval or just one or the other?
What do you mean?
The light switch to control it, or we have to
Oh,
show you
wait,
both?
well, I'd rather you guys know it from here because you can't turn it on from there. You can only change the settings.
Oh.
So I don't want you to get confused and think you can turn it off from there.
Okay.
Handpiece hose identification. Okay, so you see this chair is different too. This one has an air water syringe on the actual tray itself. This one, anybody?
Intraoral camera.
Intraoral camera, that one's the same. This one, anybody? Yes, which is also called
the scale.
the ultrasonic scaler. You guys can look at your notes. It'll help everybody, you know, pick it up. And your hand pieces. So these are your hand pieces for your hose. Like I said, on the newer chairs, they're both high speed, low speed. They can be interchangeable. So your evaluation will probably be on the new chair. Actually, let me not say that, because we might do it in different rooms.
Depends on the
We'll
chair
see.
you get.
Yeah, because last year we did it on the new chair, but that's because we were all remote. But we'll see. It's an easy evaluation.
Says a professional.
It was easy when I was in school.
Okay.
It was my first evaluation.
Okay.
Where are we? Oh, the handpiece hose operation switch. The same place where I showed you guys last time. Down here, that little switch. Once you take the handpiece out, the chair knows that that's the one that needs to be activated, unless another one is out of place or your tubes are switched. Which, this kind of looks like the tubes are all over the place. Yep. Okay. Now we are on the handpiece water control switch. Same side as it was on our older chairs, on the side of the bracket tray right here. This one has more water adjustments, because these actually work. So you can move these and adjust the waters as needed.
Any one of them?
Well, no, they correspond to these. So from left to right would be here, left to right. Okay, so it makes sense, because these don't really have water taken out of them, so these are good. We are talking about number 12, right? Okay. Your dental evacuation trap, that one's in here. On the other chair, it was where the air water syringe was at. This one is down here. I mean, technically it's still connected to the air water, to the high volume evacuation, but it's just down here. Yeah, I mean, do you guys want to see it? It's the same thing as the other one.
I just want to make in there.
It is in there, yeah, there's a little filter in it. I can bring out a filter out so you know what it looks like. Number 13 we'll get back to. Oh, actually there might be one in here. The only reason why I'm skipping that one is because, do you guys know what a view box is for? It's so you can see x-rays that are filmed. So it's like something, you know, that's kind of out of practice. You won't really see that much in a lot of offices.
It's like a light box.
Yeah. Curing light is in another chair. I'll show you guys what it looks like. Intraoral camera in here. Ultrasonic scaler on this end. Now the base height adjustment for the chairs is the same as it was in the other room. Up brings you up, down brings you down. This brings the backrest down so you can lower your patient or bring them up to the front. Oh, your swivel left lever, same concept, it'll move the chair around, and it's right here for you guys. Headrest adjustment and tilt, same thing. This is your tilt for the knob and your adjustment height up. Stuck. But, I mean, you just bring it up. And then the stools, which, do you guys want to go over it again? Or?
Which is the armrest adjustment?
Oh, yes, this one's here. So this one doesn't have a button. You just bring it back, bring it down, and it'll make room for the patient to come. You can see.
Yeah, that is.
Oh, this one.
It's nice. Okay. How do we leave our chairs? So,
A little up, not too up.
they're not all the way up. Here. Here. And last thing, I'm missing, well, not the last thing, but what else should I do?
Chair is up.
Put these on.
Yes, but your pedals, make sure your pedals,
What's that pedal for?
so this one is also, controls the chair. If it worked. This one's also supposed to control a chair.
Yeah, move it back and forth instead of
Yeah,
on the
up and
control arm.
down, back and forth, so this is another way you can control it. So aside from taking off my water bottle and putting my pedals under the chair, this chair is.
Does this work?
Oh, because it's already.
The silver one.
But you guys are gonna practice, so I'm not gonna put
What
it
is
back
first
in.
time?
Was this on mine? Let me make sure I hit everything. Yes. Questions? No? Okay. Let's walk over and I'll show you what the curing method looks like. We're gonna have to